What am I? Where did I come from? My name is Sarah Tomlinson. I came from Watford. I am a human being, a type of animal. Yes, human beings are a type of animals. So we should treat animals better. So there's a little bit about myself. I do like animals. I'm a dental hygienist and holistic therapist. I am a blogger, a writer, new writer, and not yet an author. Haven't had anything published just yet, but that will come at some point. I do hope. Excuse me, have an itchy nose. Now, I've tried to do a couple of these videos before and they didn't, I know, I just laughed and I said the wrong thing. So, to be honest, I think the more natural this is, the better it's going to be. So, what can you expect from me, my channel? Possibly a little bit about animals. I never ended up working with animals despite going to college. I studied animal care and then later studied pet psychology. I have a lot of knowledge on dog training, cats mainly, even though my dog and cat do not behave. But as we know, it is the owner and not the animal, so I only have myself to blame there. Everything and anything oral health you can expect from me. So lots of tips on how to look after your teeth and your gums. And some holistic therapy. Dental hygienists are trained holistically at university, and I am doing a little bit more of that as well. So you may and some general health things as well, and diet and nutrition and things like that. And maybe, but yeah, a bit of writing. So newly been blogging for 5 years, and just started a couple of writing courses. I'm on my second one already. That ends in a couple of weeks, and then hopefully I'll do some more things on that as well. So yeah, I think that's all you really need to know about me. My hobbies, do you really give an SHIT? Well, you might do. Gardening. Ooh, I like rearranging the house around once a month, at least, which drives my husband crazy. Who do I follow? I follow loads of people on YouTube. I'm on my personal account, but this is going to be put on my business account actually. So personally, it just tells you a little bit about me. I follow, loads of people to be honest, but the ones that are in the forefront of my mind are recently Breathe and Flow, which is a wellness yoga kind of thing. My Ring doorbell's just gone off, so the sensor, so I hope that didn't interfere there. But like I said, I'm not going to do loads of these, so we're just going to get on with it. It's going to be natural. But I did forget what I was saying. But that's another story, that's more personal. I was talking about personal. Yes, Breathe and Flow. So that's like meditation, yoga, things like that. Then Yoga with Adrian. And then Bob and Brad, the most famous physical therapists on the internet, in their opinion. Emmy Wong, Emily Norris. Probably watch Emily Norris and Yoga with Adrian the most. There are some other fitness. Oh no, there's another person that you've all probably heard of. Pamela Rife. Yeah, I do watch her a lot as well. And then lots of YouTube things, so I thought I shall start my own because I am knowledgeable in certain areas. I have my own business. I'm a freelance dental hygienist. I work in Hertfordshire in a place called Abbots Langley. So if you're local, you can see me there. I'll pop the links below of my websites, my social media, my blogging, my writing, my Facebook page. All of that I'll put in the links below. So also like products and things. If there are any oral health products I do talk about, then it would be ones that I believe in. So to start with, I'm not really selling anything. I do like advise things to my patients, but I don't necessarily sell them directly. But that's something that I will probably do at some point, because sometimes it's hard to get all the products you need at the practice or in the shop. Sometimes it's hard to get hold of. So certain products I would sell if you couldn't get hold of them, or I just direct you to another place you can get it. Just a little bit about gum disease. That's enough about me, I think. It's gum disease and tooth decay are two oral health diseases. They are diseases, and they are both preventable. So that's why it's really important to visit your dentist regularly and your dental hygienist as well, who will be able to clean the areas that you cannot clean, give you oral health advice, and make sure you look after them. And it's not just about the bacteria in the mouth and what it looks like if you don't care. You know, I've had patients that say they don't care. I don't even do the skin, clean my skin and things like that. I've had patients say to me in the past, I said, well, you don't care about it now, but one day you will. Now, if you don't care about the appearance of your teeth, or you don't care that you have bad breath because it's full of bacteria, then fine. But what about the rest of you? Do you care about the rest of you? Do you care about your heart, your brain? Because the bacteria in your mouth can travel around the body, and there has been some associations, and there is some evidence out there linking gum disease with dementia, heart disease, high cholesterol levels, low birth weight babies, diabetes, type 2 diabetes specifically. So there's a bidirectional link between diabetes and periodontal disease. So if you have periodontal disease, so gum disease, basically if your gums are bleeding, then the chances are 90% of that possibility is going to be that you do have gum disease. Healthy gums do not bleed. There are some exceptions: hormones, lack of vitamin C, some other general diseases can affect that. So yes, now I've forgotten what I'm saying again, for Christ's sake. It's a preventable disease, I think I was saying, wasn't I? So, and I was saying about the bacteria travelling around in the body and causing other issues. No, I was talking about type 2 diabetes. There you go, there it is. Ding dong up there in the brain. Ding dong. Don't mind me, I just have a bit of a large brain tumour, and I've just finished 6 weeks of radiotherapy to my brain. So I do apologise for getting some words a little bit mixed up. And I bet loads of you have logged off already because you're really bored of this really long introduction. Why do I need such a long introduction? We can just play it in the background or something while you're walking around. Who cares, type 2 by diabetes, and my battery's about to die, so hopefully I do finish this before it goes off. The bidirectional, so if you have gum disease, then it's harder for your blood sugar levels to be controlled, so it makes your diabetes worse. If you have uncontrolled diabetes, then that has a link to the gum disease as well, so that will make your gum disease worse. So I'll finish that there as an introduction, and then I'll post some videos. I don't know how often I'll do it, when I get a chance to do it. I hope you all enjoy it and get lots of inspiration and lots of tips from me. And if you want to come and see me, then by all means, I'll put my website and my email address all below as well, and you can book an appointment with me. Okay,